Hello there, hello. I now can see the comments of these. Anyway, hi, hello. I'm live maybe, and this is your free mini anatomy training lesson 2. So, first of all, thank you so much to all the people that either joined live or commented throughout the day yesterday. So I posted this onto this page, which is my Facebook Shanti Centre Training School page. And I also posted it to the Shanti Centre Yoga Holidays page because I know there's lots of people that I've met through massaging on the retreats or through yoga holidays on the retreats that this is useful information for. And I also posted it on Instagram, so I had some Instagram people, and it's also up there on YouTube. I haven't actually checked my YouTube comments, but thank you so much to everyone who commented, and thanks to even if you didn't comment for your silent presence. So it's beginning to take form now, this mini anatomy training. So I will be, let me just get rid of this. All these funny things pop up. So I'll be on here again tomorrow, Thursday and Friday at 10 a.m. So there'll be little 10-minute chunks, nothing too major. And if you really want to learn more about practical yoga anatomy, so this will be anatomy based around the skeletal and muscular system mainly, which is designed for yoga practitioners who want to take better care of themselves. Maybe you've had injuries and you want to know what's going on anatomically. Maybe you're a yoga teacher and you didn't get enough anatomy knowledge. It's very hard in a 200-hour course to put everything in. Or maybe you've learned it once and you need to, like me, learn it about 10 times before it all makes sense. So this course is for you. And also if you're a body worker, if you're a massage therapist, this kind of really helps my massage therapists. As long as you've got a little bit of knowledge of yoga, a practice of yoga, then it's going to make sense to you as a body massage practitioner or a body worker, because what you feel under your fingertips, then you can relate back. It's extremely useful stuff. We go through general kind of bones and joints and spine and everything, and then we hit more targeted area like the rotator cuff, shoulder stabilizers, hip muscles, the trunk, the torso, the spinal muscles and the leg muscles, and there's also experiential sessions that you can do on your own at home, as well as these live interactive sessions. So it's all recorded. Oh, this is very weird because I'm opposite. Anyway, it's all recorded, so if you wanted to just sign up and have the recordings at your own time, that's also okay. However, they are interactive, and it's quite a lot of material to kind of do on catch up, especially if you're like me, you've got the thing on and you're scrolling as well, and if you're replying to emails. So, having that presence really makes you kind of tune in a little bit more. But you could do it like that. It's also worth a 20-hour CPD if you're a yoga teacher and you want that certification. There is a certificate for it. You would need to come to 50% of those. So that starts next Monday, and I hope you can make it. And I just wanted to say how it's coming on. These are the people that have commented and asked for requests. So Dora was emailing me back and forth yesterday after our session. And she wanted to see about the psoas, and she was saying it might be useful as well to look at the spinal stabilizers. So I had another girl on, well, I don't know actually, it's a person on Instagram called Char Solar, and they said hips please. So tomorrow, rather than the whole hip, the hip joint is extremely complicated. But I can do psoas, so that's feeding Dora and Char Solar, and also Terry Morgan, who's watching it, with lower back and hips. So today, hopefully, we'll cover a little bit about the lower back, and hips will come in tomorrow. Thank you to Claire, Abyss, Hazel, Faithful, Beth at Mata Yoga over on Instagram, and Rachel at Winnigy on Instagram for your comments. And so how it's going to look is that tomorrow I'll do psoas and hip flexors. Then Thursday I'll look at the QL, which is amazing. And I'll also try and give you some exercises as well that could help. And then Friday's free still. So if there's anything that comes up for you, please comment, please like, share, comment, and please do kind of feel free to book up for the full course. So today, after all that 4 minutes of me rambling on, I am going to talk about the spine. So really kind of big overview on the spine. We have these things called vertebrae, which I'm sure you all know about your vertebrae. And the vertebrae are pieces of the spine that articulate together. So they slot one on top of the other, and they're very funny looking structures. And you can feel the knobbly bits. This isn't the anatomical term, the knobbly bits, but you can feel each of these knobbly bits is part of one of your vertebrae. Okay, so we have vertebrae in the neck. The first one comes just under the occiput, and there's 7 of those, so 7 neck vertebrae, and we call these the cervical vertebrae, and they're counted so that you always know which one you're talking about. Obviously, if you're a surgeon, you'd need to know exactly where you're going. They are numbered from the top down. So C1 and C2 are at the top, and they're really funny actually. C1 and C2, the C2 is like this kind of thing with a knobbly finger, and C1 is this kind of donut ring. But they can kind of move, and they give us, the beginnings of like the nodding head, and the beginnings of turning, shaking and nodding your head. And then C1, C2, C3, C4, C5, C6, C7 are our cervical vertebrae. And if you put your hand at the back of the bottom of your neck, you'll feel a very knobbly protrusion, and that's likely to be either C7 or T1. So T1 is the first of your thoracic vertebrae. So your thoracic vertebrae are the thorax meaning this kind of cage. The thoracic vertebrae then are all the vertebrae that also have a rib articulating with them. And so there are 12 pairs of ribs. There are 12 thoracic vertebrae. So each of the thoracic vertebrae, which go from the bottom of the neck to down to the lower back, really, they go quite far down because you've got these floating ribs that are quite low. But you can feel where your ribs go. They go down towards your waist, really. They're lower than you think. So these are the thoracic vertebrae, and there's 12 of those. So we've got 7 cervical, 12 thoracic, each of which has a pair of ribs articulating, moving and gliding with them. And then we get to the lower back called the lumbar spine. Lumbar is the lower back, and there are 5 lumbar vertebrae. And these are much, much bigger, much, much chunky. You can imagine that because it's at the bottom of the body, they need to be much more kind of geared around stability. They're chunky, they're big, they're gnarly. There's only 5 of them, but because they're taking all of your weight. And then they are attaching to the sacrum, which are kind of 5 fused bones, 1 sacrum. And then you have a coccyx at the bottom. So the sacrum then is where the pelvis joins. So we have cervical spine, 7, so think that's the time I have my breakfast, 7. You might not have your breakfast at 7, but it's a useful thing to remember how many vertebrae there are. 7 cervical vertebrae, 12 thoracic, lunchtime, 5 lumbar, tea time, 5 o'clock, so 7, 12 and 5. And then you have 1 sacrum and 1 coccyx. And then the pelvis kind of slots on top of the sacrum. So you can feel at the back of the body, if you put your hands around your waist and just press down underneath your fingers and underneath your thumbs, you'll feel the whole pelvis there. So it's like the pelvis kind of sits and slots on top of the sacrum. So the sacrum helps the movement with the hips, and then the pelvis is where all movement comes from. So those are your vertebrae. Now, the interesting thing about these vertebrae are definitely their shape. I mean, they're crazy, right? So these are actually lumbar vertebrae. This is two lumbar vertebrae. Now, this bit at the front, this is the front. So this bit is the back, and this, you'll see that I've got knobbly bits coming out. These are called the spinous processes, and these are the knobbly bits that I can feel. And then I've also got 2 knobbly bits on either side of the vertebra. And these are my transverse processes. So I've got spinous process, which is at the back, spinous process. Basically, a process is like a bony protrusion. So the knobbly bit is my spinous process. So it's the knobbly protrusion I can feel of my spine. The transverse processes are the knobbly bits on the side. Transverse is on the side. So transverse processes, I've got one on the side, on each side. You can't really feel these. Maybe you could feel them. We massage in between these when we go up. You might have had a massage where, you know, you kind of got sort of thumbs or fingers pressing in between each of the vertebrae, and we're pressing in between because these transverse processes on each side are sort of like hooks for muscles. So there's muscles in between each of the transverse processes, and then there's, you know, there's all these muscles, so they kind of act as hooks for muscles, so that the articulation, all of these can have tiny bit of movement in each of the vertebrae, forward, back, or side to side, that translates up the whole of the spine, giving you this kind of snake-like movement. Do you remember those snaky toys, those wooden snakes that kind of articulate? Well, it's like that. So we have the transverse processes. Now that's the back, so that's the back view, and this is the front. Now the front, you've got this big chunk of the vertebrae. Like most of the vertebrae is this like front bit, which is called the body of the vertebrae. And in between the bodies, you've got your spongy discs. And that's what the discs are. So you can imagine there's discs in between each of the vertebrae. So the whole spine from the front looks like this. I've got body, disc, body, disc, body, disc. And these are the 5 lumbar vertebrae. You can see how huge they are. The lower down the body, the more built for stability. And then at the top here, I've got tiny little discs. This is at the top of the body. This is my skull here. This is the front of my cervical vertebrae. The bodies are small, the discs are small because I've got less weight pushing down. So there we are. And then what you've got, and I think you can see this close up, you've got these little, these are nerves. So in between each of the vertebrae on either side of the spine, you've got these pairs of nerves coming out. So what happens is you've got your central nervous system is the brain and the spinal cord. The spinal cord travels through this hole. This is my main spinal nerve, and it travels through this hole called the vertebral foramen, just this hole inside. So it's between the body, and then I've got spinous process, transverse processes. So the spinal column is coming down. So it's central nervous system is brain and spinal column. Then these nerves, pairs of nerves, come out each side between each of the vertebrae and innervate the rest of the body. So your cervical nerves are going to be sending messages to and receiving messages from your arms and your chest. Your thoracic nerves are going to be sending messages and receiving messages from the abdomen and the abdominal organs. And then your lumbar nerves are innervating your legs, your bladder, your bowel, and your pelvis. So that's why if you've got tingling in your hands, we can tell if there's nerve sensation in a part of your body. You can tell then which part of your spine might have a bit of pressure on it. So normally people kind of experience, tingling or numbness in their hands. We know that those nerves are served by the cervical plexus nerves, which means the nerves coming out from either side of the cervical spine. So we can use information from the body to trace back where the nerves are, and the nerves originate from this main spinal column, the central nervous system, and so we can tell that maybe there's some wear and tear in the discs or the spine. And what happens is that we have these how the spine articulates, how it creates movement, as well as from the muscles that are all hanging around. We've got the discs at the front, which give this spongy kind of sort of like a suspension system, and we're going to keep them nice and plump. You can imagine gravity is pushing us down. That's why we want to lengthen the spine. That's why we do all these kind of movements to kind of in yoga to make space in between the vertebrae. So that's at the front. And then at the back, just to make things a little bit more complicated, as well as the transverse processes on the side, the spinous processes on the back, we have each vertebra, if I can kind of separate them out. Each vertebra has got these, well, I think they look like teeth, and these are they all look slightly different, and you can tell which part of the spine you're looking at from the shape of the the knobbles. But anyway, these are lumbar vertebrae, and we've got two knobbles down, pointing down, and two knobbles pointing up. And these form the facet joints or facet joints because the bottom two of one vertebra articulate with the top two of the next. And these are called facet joints, and so these give me a little bit more movement when the facet joints kind of sit next to each other. These are actually synovial joints, so there's synovial fluid, which are the most mobile joints. They have this kind of lovely synovial fluid which gives them the sponginess and this lovely slide and glide movement. So your movement comes from the facet joints either side of the back as well as the disc at the front. So if I go into let's think I'm going into a forward bend. So this is me, I'm sitting, I'm facing that way, and I'm going to go into a forward bend. And I'm going to press on the front of my disc, and my facet joints at the back are going to kind of open up. And if I go into a backward bend, then I'm going to be more kind of bringing the facet joints at the back towards each other and opening up the disc. And the disc problems, when you've got herniated discs, or people talk about slip discs, and they don't go anywhere. But if I'm in a forward bend, the risk and the pain can come from going into a forward bend, pressing the front part of the disc and kind of opening up the back part of this. And what can happen is that proteins will leak out and hit the nerve, and this causes pain. So we've got the facet joints at the back, we've got the body of the disc, we've got the body of the vertebra, we've got the discs in between the vertebra, we've got the transverse processes, we've got the spinous processes, and that's probably enough information. But just to tell you that each of the sets of vertebrae, the reason we have segregated them into 7 cervical, 12 thoracic and 5 lumbar is because they all have a slightly different job, which means they have slightly different shape, and the shape can tell us what they do. So the cervical vertebrae, they allow for a lot of movement. So we have a lot of movement because this is where our eyes are. Evolutionarily, I need to be able to see what's in front of me. I need to see what's behind me. I've got a lot of movement, forward, backwards, side to side, rotation. The thoracic vertebrae have got a big job to do because they're articulating with ribs. I need them to be stable and secure. There's less forward and backward bending available to me because I need to protect my vital organs, my heart. So there's hardly any forward bend available because I've got this rib cage in the way, bone hits bone, and there's very little backward movement because my spinous processes are actually facing down. So if I back bend, they just hit each other. So bone hits bone, that's the end of my movement. But I've got a lot of rotation available here because the facet joints kind of are horizontal and they just slide and glide. So that enables me to get lots and lots of rotation here rather than forward bending and backward bending. Then my lumbar vertebrae, they allow again for a lot of forward and backward movement, but not very much rotation. And the rotation you can see here because my facet joints, it's really difficult because I'm mirrored, so I can't really tell where I am. Okay, my facet joints here that we just spoke to, they're kind of sitting in between each other. So if I want to twist, I can't. I'm trying to twist and I can't because bone hits bone. So it tells me that I've got a lot of forward and backward movement in the lumbar, but not so much twisting. So once we relate this back to movement, it gets very interesting. That's why people are always cueing us in yoga or movement practice to lengthen through the spine, make space between the vertebrae before we do anything. That's why when we go into twist, we want to keep it out of the lower back and more into the thoracic because that's what's available to us, because we've got quite a lot of almost hyper mobility in the neck, and the neck's another whole problem. I've done another video about it. We try not to overstretch the neck because it's already very prone to kind of hyper mobility, and then we sort of sit like this and look at our phones and do awful things with our necks. So we translate that back to our general movement practice and hopefully gives us some information. that's the spine in a nutshell. I mean, you know, that's a tiny bit of the spine. I hope you were able to sit through that. And tomorrow I will be doing the hip flexors. So we'll talk about mainly the psoas really. And tomorrow I will also give you some good tips on how to kind of strengthen and lengthen the psoas muscle of the hips, because usually that's the silent hip muscle. I mean, there's loads of hip muscles and they're all equally important. The body is like an orchestra. All of the muscles need to be working just a little bit. They all need to be working in harmony. And what happens in life is that often we get some that are really strong and some that are weaker, and so we sort of need to kind of take some of the power away from the ones that are doing all the work and bring some of the weaker ones and make them work a little bit harder. So we need this orchestra, but psoas is usually, you know, people want to know about it. It's quite complicated, so I'll talk about that tomorrow. Thursday, I'll talk about the spinal stabilizers, the QL. Usually if I massage people, there's always some junk in the QL to be massaged out, and that's quite a nice one, easy to work on with side bending. And then Friday's open, so let me know what you want, and I will see you tomorrow. Bye.